Well, shoulder replacement is surgery designed to help people with arthritic shoulders. An arthritic shoulder is one where there's no cartilage and there's bone on bone. It's characterized by pain and loss of motion and loss of function. So a standard shoulder replacement is designed to replace the anatomy as it exists. So the way it works is your shoulder is a ball and a socket joint. So this is your arm bone, your humerus. At the top is a ball, which is called the humeral head. So in the standard anatomical shoulder replacement, we call it, we take off the existing ball on the humerus and replace it with a metal ball. We also, in order to make it stay put, we put a stem down the humerus, which is here, it's a metal stem, and then we place the humeral head on like this, so it's a modular thing so that it can fit the anatomy as it was before. On the socket side, what we do is we cover the socket with a plastic piece, and that's essentially cemented in. It can be either a keeled kind of component or it can have pegs like this component. And as a result, when it's all said and done, you end up with a ball articulating or in the joint with the socket. So it essentially replaces the normal ball and socket so that you again have metal on plastic, and that gets rid of the pain. So a reverse shoulder replacement is exactly like it sounds. In a normal shoulder, you have the ball on the arm side, and in a reverse arthroplasty, the ball actually is on the socket side. So this is the shoulder blade, this is the ball, which would normally be on the humeral side. So what happens is on the humeral side, we still have a stem down the center of the humerus, but there's a plastic piece on the humeral side instead of on the socket side. So instead of the ball being on the humerus, it's again on the socket side. So when you put it all together, the two match very nicely so that they stay together. This essentially eliminates the pain also because you don't have bone on bone any longer, but you have metal on plastic. In that sense, it's similar to a standard replacement, except again, the ball is on the opposite side or on the reverse side of a standard shoulder replacement. There are several reasons to have a reverse total shoulder replacement as opposed to a standard anatomical shoulder replacement. The most common reason is when the rotator cuff tendons are torn to the extent that they can't be repaired surgically. In that case, sometimes people get also bad pain or bad arthritis, which accompanies the rotator cuff tear, and the reverse arthroplasty allows the shoulder to function normally. In a standard replacement, if you don't have a rotator cuff, it can lead to early failure. The good thing about a reverse is it's actually designed for people who have a torn rotator cuff. The other group of people that it's very good for is in people who have worn the bone away on the socket side. With a standard replacement, you need enough bone to be able to place the component with the pegs so that they stay cemented in place. Sometimes that's very difficult to accomplish. So the good thing with a reverse arthroplasty is it can be used in patients who've lost a lot of bone. For example, this is a scapular model of someone who's lost a significant amount of bone in their socket. The socket should be perfectly flat here, but you can see that it's very dished out and there's a lot of bone missing. With a reverse arthroplasty, you can place the base plate and the ball on the socket side without too much difficulty, and it's very effective in terms of getting rid of pain and helping people resume or get back their motion. There are other reasons for a reverse arthroplasty as well. Sometimes people have fractures that need to be fixed or fractures that have healed in the wrong position that are best treated with a reverse arthroplasty. Also, people who've had long-standing arthritis to, say, rheumatoid arthritis or to multiple dislocations of the shoulder. Many of these patients were not able to be helped very effectively with standard shoulder replacements, which now these days with reverse arthroplasty can be treated quite nicely, and they get very excellent pain relief and function. So as far as the recovery of shoulder replacement surgery is concerned, the good thing is that particularly with a reverse arthroplasty, you can be up and around almost right away. There's really not as much pain with a shoulder replacement as with other major joint replacements such as knee replacements or hip replacements. As a result, patients typically don't need as much medicine and don't have as many side effects of the medicine. So we let people start using their arms right away, and they can usually feed themselves within a few days. So the ability to recover from a shoulder replacement is quite good compared to other joint replacements. Typically admit patients for at least one night after surgery to make sure that there's no trouble with pain or medical issues. Most patients don't bleed enough to need a transfusion, so transfusions after shoulder replacements are quite uncommon. Most people are up and around within a day or two. We usually discharge patients after 2 nights if necessary. Most people can feed themselves again within several days. Most people can drive within 2 to 3 weeks. So recovery from a shoulder replacement, including reverse replacement, is really quite short. One of the great advantages of a reverse total shoulder arthroplasty is it allows us to take care of problems around the shoulder that we've not been able to take care of in the past. Particularly things that we can take care of are failed shoulder surgeries, including failed previous shoulder replacements. Fortunately, shoulder replacements don't fail very often, but when they do, the surgery can be somewhat complex, and we are able now at this point to be able to replace any shoulder replacement to provide more function for the shoulder that has previously failed. Also, reverse arthroplasty has been used for people who've had failed fixation for fractures or for fractures that have not healed appropriately, and a lot of other indications that the standard shoulder replacement was not as good at taking care of.